Hello, and welcome to the Parkinson's Foundation Wellness Wednesday. My name is Laura Summers, and I'm on the community programs team here at the Parkinson's Foundation. Today, we are pleased to bring you what is advanced care planning. Welcome to everyone. As we begin, I just want to make sure to take a moment to share about the mission of the Parkinson's Foundation. Every day and in everything we do, we are working to make life better for people with Parkinson's. To achieve our mission, we pursue three goals: improve care for everyone with Parkinson's, advance research towards a cure, and empower and educate our global community. Today's program is a great example of one of the things that we are doing to help us meet those goals. Another example of our mission in action is PD generation. This research offers genetic testing for PD-related genes and genetic counseling to people with Parkinson's at no cost. Commit to helping us advance Parkinson's research today. You can check your eligibility and enroll now to be a part of PD generation at parkinson.org/PD generation. I'd also like to take a moment to recognize that PD Health at Home is presented by Light of Day Foundation, whose generosity has made this programming possible. The Parkinson's Foundation has been providing weekly educational wellness programs virtually through our PD Health at Home series, including Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. As a reminder, all of these programs are held at the same time right now, 1 p.m. Eastern, and you can learn more and register for these programs by visiting parkinson.org/PD Health. You can also learn more about all that we have to offer to the Parkinson's community by visiting our website, parkinson.org, or calling or emailing our helpline. You can call 1-800-4PD-INFO, and the email address is helpline@parkinson.org. And now I'm pleased to introduce our speakers for today. Erin Cecchi is a licensed clinical social worker with many years of experience in healthcare and has a deep passion for working with individuals with neurological conditions. Erin is currently the Senior Program Coordinator for the Parkinson's Disease and Movement Disorders Center in downtown Chicago. In this role, Erin facilitates several support groups and coordinates the center's educational offerings. We'll also be hearing from Debi, who is a licensed clinical social worker who has been working with people with neurological disease and care partners for over 30 years. She has been working with the Movement Disorders and Neurodegenerative Disease Center at Northwestern Medicine's Central DuPage Hospital since 2014. In her present role, she provides counseling, education, and facilitates groups for people with neurodegenerative diseases and their families. And we will also be hearing from Linda Egan, who is a physical therapist and has a personal connection to the field of neurology as her father has Parkinson's disease. Linda is currently the Parkinson Program Coordinator at Northwestern Medicine Lake Forest Hospital in Lake Forest, Illinois. In this role, Linda collaborates with clinicians, patients, and their families to develop and implement appropriate treatment plan. She organizes all aspects of Parkinson's support groups, community educational events, and is involved in the development and implementation of community-based Parkinson's exercise classes at Lake Forest Health and Fitness Center. And now we'll hear from our speakers.
To begin today's presentation, I want to define what is meant by advanced care planning so we all have a shared understanding of what we're talking about. A consensus statement released from a multidisciplinary panel states, advanced care planning is a process that supports adults at any age or stage of health in understanding and sharing their personal values, life goals, and preferences regarding future medical care. The goal of advanced care planning is to help ensure that people receive medical care that is consistent with their values, goals, and preferences during serious and chronic illness. So what is involved in advanced care planning? Well, we can break this down into three larger categories of discussing, making decisions, and directing care. Advanced care planning involves discussing your wishes, preferences, and goals regarding future medical care, making decisions based on those discussions and documenting those decisions, and finally, directing care to ensure you will receive the type of medical care you want. It's important to note that going about advanced care planning requires a tailored approach based on individual circumstances and is not something that fits into a one-size-fits-all approach. It can require a lot of flexibility and multiple conversations and decisions that need to be made. I think it's beneficial and necessary to discuss the importance of why we are talking about this topic today. It is important to do so to ground the conversation and hit home how this is relevant to all our lives, and especially for those living or caring for someone with a neurological condition. So there are many evidence-based benefits of advanced care planning, which includes that it increases autonomy and self-determination. It is really important for people to feel in control of their body and the care that they receive. It ensures that people receive care that is consistent with their preferences. It reduces decisional burden of families as to whether they are making decisions that are consistent with the preferences of a loved one. It positively impacts quality of life, and it can help to avoid undue suffering, and of course, many more reasons which may be unique to you. So whether you're a person with a neurological condition, a caregiver, or someone else, having conversations about future care should be an essential part of planning for your future. And here are some steps for implementing the advanced care planning process. This is by no means an exhaustive list or a list that needs to be followed in this exact order, but it serves as a good starting point to understanding all that is involved when we talk about advanced care planning. The first step involves exploring your values, choices, and treatment options, and this will be covered as part of today's session. The second step involves choosing a healthcare proxy and a proxy to manage your finances or property, or in other words, choosing an advocate to act on your behalf in the event that you weren't able to make your own wishes known. This step is often done with the help of an attorney, and this step will be covered in session 2 of our 3-part webinar series. The third step is to document your specific decisions. Documenting your decisions is done by filling out an advance directive, and this also will be covered in detail in session 2. It is then important to make copies of any legal documents and have conversations with people who will be involved in your care. Step 5 involves researching and securing resources for the future. And finally, step 6 is to continue these conversations and adjust your plan as needed. So again, as you see, these steps don't always follow a linear path, and you may find yourself revisiting the same steps multiple times. So we know for certain that people with neurological conditions should be engaging in advanced care planning, but it's really important to state that everyone, regardless of health status, should engage in advanced care planning. It's for you, your family, friends, and anyone who identifies as a caregiver. Advanced care planning is often thought to be reserved for those with serious illness, but it is truly a discussion that we all should be engaging in. Now that we know who should be engaged in advanced care planning, it's also important to know who you may want to be involved in this process and in key conversations. Many people find it helpful to include their spouse or significant other, family, friends, healthcare providers, lawyers, financial planners, and care managers. It is likely that you won't have one conversation with all of these individuals, but rather multiple conversations with different people over time. And not so surprisingly, you're likely to engage specific people for specific reasons. For example, you might seek out a lawyer when wanting to talk about documenting legal and financial decisions, and you would talk to your healthcare provider when you want to discuss specific treatment options related to your health condition. Similar to the statement that everyone should be engaged in advanced care planning, it is also key to note that advanced care planning and the conversations it entails can be had anytime regardless of your health status. However, we do know that the first time you may be introduced to advanced care planning is when you already have a serious medical condition. Therefore, it can be key to start having conversations early on after you receive a diagnosis. This can be important, especially for individuals with a neurological condition, as we know many are progressive and can impact someone's cognition and speech. It is also important to have these conversations after there is a change in medical status. It is not uncommon for care preferences to change after a medical event. For example, after suffering a fall, someone with a neurological condition may experience a decline in their ability to care for his or herself. And this change may prompt you to revisit your preferences for where you want to receive care, who you want to receive care from, and what type of care you would or would not want. So again, as you can see, advanced care planning isn't a one and done conversation. Rather, it can be an ongoing process. So as we've discussed, step one of advanced care planning involves exploring your values. Each of us has a set of core values as well as a personal sense of who we are, what we like to do, the control we like to have, the goals for our life, and what we hope for. All of these things help us to establish priorities in life and can guide decision-making about our health. This step involves quite a lot of introspection and self-assessment. It can be helpful to ask yourself some questions to begin to identify what matters most to you. Questions such as, what is most important to you? What do you value the most? What influences your values? What gives you strength? What brings you joy? When you look ahead, what do you hope for? And what matters to me through the end of my life is, and fill in the blank. It's important to note that your values may differ from others who are involved in your care. And it's not uncommon for an individual with a neurological condition to have different values and wishes than their care partner. And knowing each other's values and differences can be important in guiding decisions. Also involved in step one of advanced care planning is exploring your healthcare decisions. And there are some questions that can be helpful to consider, including questions such as, how much do you want to know about your health condition? How involved do you want to be in making medical decisions? What are your concerns when it comes to your health and possible medical treatments? How involved do you want others in your care? What medical treatments would you want or not want? Do you have any fears, concerns, or mistrusts about where and how you receive health care? Answering these questions can be helpful and impact how you involve your healthcare team. For example, if you are someone who wants to know a lot about the prognosis or expected path your condition might take, you may want to ask for an appointment with your doctor to talk further about specific questions you have. As we've noted, our sense of self and values are likely to influence our goals and expectations for our future, and this can influence our decision-making. However, this is not all that can influence us, and it's important to consider how other areas in one's life and background can influence how we engage in advanced care planning. So cultural factors that can affect the acceptability and willingness to engage in advanced care planning include someone's religion or faith, their trust in the healthcare system, both the patient and clinician's comfort discussing death, as well as a person's attitude regarding decision-making. Language barriers can also impact someone's ability or willingness to have certain conversation, as providers may not have the tools to serve someone in their preferred language, and some things may get lost in translation. Each of us come with a unique set of personal and life experiences, which inform how we interact with the world around us. There can also be familial beliefs and cultural traditions that can affect decision-making and medical choices. For example, we may have different ideas about the meaning of death and dying, the role that extended family members take in decision-making, and the meaning of pain and suffering. Also, something important to consider when engaging in advanced care planning is partner and family involvement. How involved do you want others to be? This can be especially important to consider if you are in a same-sex partnership where you are not legally married. Without proper legal documentation, partners who aren't legally married may have limited or no rights regarding medical decision-making and treatment planning for his or her partner. This can be complicated even further if there has been a history of non-acceptance of the relationship by the person's biological family members. So as you can see, this slide really hits home the complexity of what can go into advanced care planning.
I often speak about ethical considerations when I talk about advanced care planning. That means that there is usually no perfect plan, but rather a negotiation over time about care options, looking at different people's needs. It is the idea that people and families often negotiate between what the person with neurologic condition wants, making every effort to support their autonomy and desire for independence, with the needs of the family and safety of the individual. This often leads to a conversation about autonomy versus safety. What can someone do by themselves, and how safe are they doing certain activities? Think of the safety of living alone, taking a walk, or managing finances. You may also consider self-determination versus the needs of others. Think about driving, balancing someone's wish to continue driving versus safety of people in other cars and pedestrians. There are good programs to help assess that risk. How do we balance the ability to make our own choices with the needs of those caring for us? Wellness is important not only for people with neurologic conditions, but also for their families. There are times when adult children and spouses have to figure out what they are able to do and what they are not able to do for their loved one. This may change over time. Some of the nuances of advanced care planning are exhibited through this quote from a caregiver. Please know the names have been changed. We tried everything. We tried to agree on everything. Bob did not want paid caregivers. Fortunately, a speaker in a webinar talked about making the right moves before caregiver burnout strikes. That helped. When I wanted to add hours, Bob would object, and I would say, this isn't about you, this is about me. With the benefit of hindsight, we should have had more help sooner. This exemplifies families' needs negotiated along with the needs of the person needing the care. We wanted to address the timing of implementing advanced care planning, along with considerations of ethics. You have this great plan, which you've thought about carefully, marshaled your resources, appointed powers of attorney. There is still an ongoing dialogue as to when to implement. There are challenges to when to hire someone to help you in the home, have someone go to a day program, move to a facility, enroll in palliative care. Some of this may be determined by what you may consider red flags. In a facility, when we saw someone going back and forth to the hospital a number of times in a short period of time, that was a trigger to begin to have a discussion about the need for the next level of care. This same consideration may be considered, may be something you consider when your loved one is still living at home. Maybe one car accident is enough to say it's time to stop driving, but a number of scrapes on the car, accidents, speeding tickets may mean it's time to retire from driving or have a driving assessment. It can surprise some of the people I work with and their families, the intensity of feelings that often arise in making these transitions. I often encourage people to think of their experiences of illness in the past, how families have dealt with it. Early trauma can inform adjustment of person with disease and family to illness. An example of this is that I can see some people with early memory issues where they want to place the person immediately into a facility, and where in another family, they may have their loved one at home even as they are reporting that they are feeling physically threatened by that person. Financial discussions are another aspect of advanced care planning that is very important. People often delay setting up needed care as they worry they cannot afford the care, or they are worried they are going to run out of money for care. And there is no doubt about it, care is expensive. This is why If you have money and assets, it can be helpful and important to speak to an elder law attorney or a financial planner with some expertise in this area to plan ahead and then check in over time. If you need financial assistance for care, I recommend reaching out to your local area agency on aging. Every agency serves a different geographic area and will have different services available. But these agencies are a great source of information and resources for older adults and adults with disabilities. Now that we've addressed what goes into advanced care planning and some considerations to take when engaging in these conversations, I want to talk about setting the stage for having these conversations. Again, it can feel like a big undertaking, but it doesn't have to be a one and done conversation. With each conversation you have, whether it is with your partner, adult child, or healthcare provider, it can be helpful to ask yourself these questions. Who do you want to be part of this conversation? Where do you feel comfortable talking? When will you start the conversation? What do you want out of the conversation? Asking yourself these questions can be key in grounding yourself and getting the most out of each conversation you're having. It's also important to keep in mind that each person engaging in these conversations, whether it be the person with the neurologic condition, a family or friend, are likely to have different levels of comfort in having these conversations. That's okay and to be expected. One Parkinson's caregiver shared that if their friends before the Parkinson's diagnosis were uncomfortable talking about Parkinson's, then they simply accepted that and built a new core group of friends and supporters who are able to talk openly about Parkinson's disease. As we are talking, it's not hard to see how overwhelming these advanced care planning conversations can be. There is a lot to consider and a lot to think about. We want to acknowledge and name the discomfort that often comes along with discussing advanced care planning and having certain conversations. It's important to normalize these feelings because not doing so can lead to avoidance. The discomfort may be an unavoidable consequence of advanced care planning, but it doesn't mean there isn't something you can do to ease the discomfort. Here are some things that can help. More education, acknowledge and name discomfort, fears, and emotions, go at your own pace, break conversation up into smaller chunks, and seek help from professionals who can help with these discussions. Talking about our values, wishes, and goals is of paramount importance when it comes to advanced care planning. And also just as important is to plan and set up care options for your future. So why is it important to plan and line up care early on? Well, having a care plan is essential to ensure that you consistently receive the right level of care and that your personal requirements are known by care workers and the people around you. An effective care plan will help you to better understand your condition, live as independently as possible, and have more control over your life. Asking yourself and even your doctor about the types of care and support you may need in the future can be helpful. Then you can ask yourself, who would you ideally want to provide this care? When should care be provided? And what are the costs of services? Asking yourself these questions ahead of time and taking time to plan will better allow you to identify services in the community that align with your values. The importance of planning for care is best exhibited through the experience of a caregiver who was taking care of her friend with a neurologic condition. The caregiver shared, "It is critical to have serious discussions early on. During the last few years, I asked my friend to let me help organize her house, but she was really resistant to any major changes. There should have been a discussion up front about who will help maintain things. not when it became an issue. I don't think she anticipated ever being unable to navigate around her house. When planning for care, ask for help in these discussions. Elder law attorneys, physicians, clergy, and counselors specializing in aging may be able to help. This slide lists examples of areas to think about and plan for. As you can see, there can be many areas to plan for, which can contribute to feeling overwhelmed if you find yourself having to plan for all these things at once. Again, this is why it can be helpful to break these conversations into chunks and find people and resources who can help you address different areas. When planning for care, there are a variety of services that may be available to help. While we will not be able to go into detail about every service available, this slide serves as a reference for the type of services available. And they include, you can see the whole list here. We will address a number later, but I did want to highlight two very, very important things to think about. Respite. I'm highlighting this one as sometimes just a little break can make a big difference for the care partner and the person being cared for. Also, palliative and hospice care. We will have a speaker to speak more about this in session 3, but suffice it to say, palliative care is open for having a consultation at any stage of a chronic condition. Focus is not on curing disease, but how to live the best quality of life you can with a disease. So who pays for all this care we are talking about? Unfortunately, there is not one payer source who can pay for all the type of care you need. As I mentioned, we know care can come at a high cost. Who pays for care is often cited as one of the most stressful aspects of advanced care planning. It's a whole lot easier to say I want 24/7 in-home care than it is to come up with a plan to pay for that type of care. This slide lists common funding sources to pay for care. They include private pay, state subsidized benefits, VA healthcare for qualifying veterans, long-term care insurance, support organizations, and grants. Again, this can be stressful aspects of advanced care planning. It can be helpful to plan ahead and elicit the expertise of financial advisor or elder law attorney. The remainder of today's presentation will delve into certain aspects of care and scenarios you may find yourself having to plan for, which is step 5 in our advanced care planning process.
It is not uncommon for people with neurological conditions to require hospitalization at some point. A trip to the hospital can be a stressful event for patients and their families. Hospitalizations, referred to as acute care, describe a level of health care wherein a patient needs immediate yet short-term treatment. For people with neurological conditions, common reasons for hospital admissions include dehydration, infections, falls, a sudden decline in cognition, sudden behavioral changes, and pneumonia. It is important to know before you go. Be prepared. A caregiver who can act as a thoughtful patient advocate, asking the right questions, keeping track of hospital personnel and their directives, monitoring medications can make all the difference and ensure a comfortable, safe, and hopefully brief hospital stay. How do you prepare for hospital stays? We asked some caregivers how they prepared for a hospitalization, and here are tips and insights they shared. One caregiver shared, I had an envelope which included specific items and was updated and ready to go whenever I needed to take him to the hospital. The envelope included advance directives, legal documents, height and weight, date of birth, addresses and phone numbers, all physician contact information, an up-to-date medical history, updated medication list, including prescription and over-the-counter medication and supplements, known allergies, copies of all insurance cards, immunizations, especially the COVID vaccine card, notebook to keep track of medical staff names and treatments. The same caregiver shared some ideas of items they wish they had brought to the hospital, and this included 1 day's worth of medication, because sometimes we waited in the ER for more than 3 hours, water to drink to take the meds, something to eat to combat nausea from the medication, and something to keep you occupied while waiting. After going through hospitalizations, one caregiver shared what they learned. She said, "Be an advocate for your loved one, but also one for yourself. It is okay to admit that you need help. You should not be shy about asking hospital staff for help at any time, and make sure they understand your situation. If hospital staff use terms or acronyms you don't understand, ask them to explain. During a hospital stay, ask for necessary evaluations. Ask for physical, occupational, or speech therapy if your loved one is having difficulty with balance, general mobility, swallowing, or speech." One caregiver stated that my husband was admitted into the hospital, and after an OT and PT evaluation, he stayed for 2 days. It gave me the time I needed to line up in-home care and ready our home with the necessary medical equipment. The stress of hospitalizations can be perfectly seen through this quote when a caregiver shared, "Sometimes it is emotionally difficult to plan ahead because it forces you to think of unpleasant eventualities. However, I found it very stressful being forced to act without much time to research available services, and I had to scramble to get agency names and phone numbers." It is clear to see just how involved and complex hospitalizations can be. When in the hospital, you are focused on your family's medical treatment, so you might not give much thought to what happens when your family member leaves the hospital. The way this transition is handled, whether the discharge is to home, a rehabilitation facility, or a nursing home, is critical to the health and well-being of your loved one. Studies have found that improvements in hospital discharge planning can dramatically improve the outcome for patients as they move to the next level of care. The discussion needs to include what to expect after discharge, an updated list of medication and any new test results, along with the follow-up plan. These discussions can include talking about the physical condition of you and your family member, both before and after the hospitalization, details of the types of care that will be needed, and whether discharge will be to a facility or home. It also should include information on whether the patient's condition is likely to improve, what activities he or she might need help with, information on medication and diet, what extra equipment may be needed, such as a wheelchair, commode, or oxygen, who will handle meal preparation, transportation, and chores, and possibly referral to home care services. Be aware of possible COVID restrictions and guidelines at care facilities your loved one may be transferred to. One care partner's shared experience highlights the importance of addressing everyone's needs in discharge planning. She states, "All the time we spent at the hospital, no one ever asked me how I was doing and if I would be able to manage my husband's new health challenges. I liken these progressive diseases to playing whack-a-mole. You get one challenge addressed and a new one pops up. Upon release, I realized I could not get my husband in and out of the car by myself and needed a medical van to take him home. It was a new first.
One area of care to plan for, which is often ordered after a hospital stay and provided in your home, is home health. Home health care offers a wide range of services that can be given in your home for a specific health condition. Home health is not a service you can receive on a continuous basis and is usually provided for weeks at a time to address specific concerns and goals related to your health condition. Home health services can include nursing, physical therapy, a home health aide, speech therapy, occupational therapy, and social work. This is a service that is ordered by your doctor and covered by insurance. It's an important aspect of care as it has been proven that proper rehabilitative care can positively impact those with neurological conditions and allowing them to maintain as much independence as possible and pursue the best quality of life possible. One caregiver advised it can be especially helpful to get an order for home health occupational therapy to assess your home and suggest changes. This is what's commonly referred to as a home safety evaluation. And during an in-home safety evaluation, an occupational therapist is assessing the structure of your home and can make recommendations to make your home more suitable. It's important to note that home health care is paid for by Medicare and most other health insurance companies, although it may not cover the full cost. And you can receive home health care for as long as you qualify. Yet again, it's important to note that it's not something you can receive on a continuous basis and can be usually provided at weeks at a time. Another category of care and area to plan for falls under the umbrella of in-home assistance. This can be also known as personal care, attendant care, non-medical care, and companion care. Examples of the type of help in-home assistance can provide includes assistance with eating, bathing and maintaining personal hygiene, dressing, toileting and basic mobility, preparing meals, transportation assistance, light housekeeping, laundry, and shopping for essentials. It may also include companionship and supervision. The average national cost for this type of non-medical home care is $21 per hour, with state averages ranging from $16 to $28 per hour. Unfortunately, this type of care is usually not covered by health insurance, but it may be, so please always check with your plan. But again, there are a variety of ways that you may pay for this type of care, including your state's Medicaid program, private pay, grants, long-term care insurance, veterans benefits, and other geographic or needs-based assistance programs.
Adele Daycare, from my perspective, is the win-win of dementia care and also can be great care for other people who have neurologic diseases, specifically when that person is living with a loved one. It gives people with neurologic disease a place to go and have meaning and purpose in their lives when they cannot organize that for themselves. It also gives family respite, and it is less expensive than having in-home care or placement in a facility. Family members have told me that their loved one won't ever agree to go to a day program. I've encouraged them to make a deal with their loved one, trying to go twice a week for a month and then reassess. Usually by then, the attendee is very happy to attend. We know that care at home may not be the only type of care needed, and the next few slides will address other options that may be available. Assisted living provides personal care support services such as meals, medication, management, bathing, dressing, and transportation. It's ideal for people needing some assistance with personal care, are able to walk or are ambulatory, and are receptive to assistance. Cost varies greatly. The national average rate for a one-bedroom apartment is approximately $4,300 per month. This is not covered by Medicare and healthcare insurance. Assisted living is great for people with some minor physical issues and okay for people with mild cognitive issues, but not with a dementia. Those people are better off in an assisted memory care facility. Assisted living is mostly funded by private pay, but in some states, there may be similar living facilities with other funding options. Memory care. Residents may live in a semi-private apartment or private rooms. Many assisted living facilities, continuing care retirement communities, and skilled nursing care facilities have special memory care neighborhoods or designated floors. They have structured activities delivered by staff members trained specifically on caring for those with memory impairment. Average cost of memory care for a single resident was almost $7,000 a month. Fewer supportive living dementia facilities, so mostly this is a private pay domain, although the VA and long-term care will pay for this level of care. And this is truly an unmet need and an advocacy issue in our community. Lots of things to consider in this level of care. I encourage people to be honest as to their care, their concerns about for their loved one. If there is a person who is a fall risk because they have advancing Parkinson's disease, this may not be the right place. There are a lot of facilities in the round for people that need to walk a lot, while some memory units may be very small. Finding the right facility depends on the specific needs of a particular person. Skilled nursing facilities are for individuals who require 24-hour monitoring and medical assistance. Key is to consider that if a person needs a two-person transfer, an assisted living facility will not accept them, and it gets harder for families to manage this kind of care at home. The national median cost of a semi-private room in a nursing home in the US is $250 a day, and the cost of a private room is $290 a day. Medicare will only cover for rehab stays after a hospitalization lasting at least 3 nights. So Medicare will not pay, healthcare insurance won't pay, but Medicaid will pay for some facilities if you do run out of money.
So planning for care is important, and a lot of our discussion today has included the importance of the role of caregivers and the need to rely on family, friends, and other social relationships for that care. But for many people today, those relationships and supports aren't available. So what to do when you're planning for care alone? Well, first, it can be helpful to plan ahead. This is really true for everyone, but maybe especially so when you're the only one looking after you. So looking into services before you need them is key. And when researching services, it can be helpful to keep a list of important information and resources in one place. If a person does not have a support network to rely on, chances are you may have to pay for care when it is eventually needed. And this is where hiring a geriatric care manager or meeting with an elder law attorney can be helpful. They can help you plan for different areas of your life and make arrangements for how to pay for that care. Keeping up with medical appointments is of central importance, as your healthcare provider may be the only other person paying attention to your health. And documenting healthcare wishes can be especially important. If you don't have a healthcare agent, some states have documents called living wills, which allow you to make your wishes known. And finally, stay engaged. The biggest 2 things you can do to stay healthy as you age is exercise and eat well. So we asked someone living with a neurological condition and planning for care alone what their experience has been, and this is what she shared. I still need to change my durable power of attorney as my older sister no longer feels capable of taking that role. So in this person's case, revisiting documents is important. and they will now need to think about who else to name as their advocate. If no one comes to mind, you may consider talking to an elder law attorney about options or searching online for highly rated professionals. And the same person planning for their own care shared, on the plus side, as I completed physical rehab, my physical condition and Parkinson's has improved, so my doctor thinks I'm still not needing a caregiver for a while yet. And for now, my plan is to stay as active as possible. So here, it really exhibits the importance of staying on top of your health. Today, we've addressed a lot, and understandably so, it can be overwhelming to begin to undertake the advanced care planning process. Therefore, we wanted to share the personal experience of someone who has started this process. The gentleman you will hear from speaks to his experience setting up plans for him and his wife's future and documenting those decisions. Also, his experience speaks to the creative and individualized approach we can take when engaging in advanced care planning, as well as the importance of the legal planning piece, which will be covered in more detail in session 2 of our 3-part webinar series.
Hello, this is Bob Duke and Carol Bauman, except my wife is running around the house somewhere, so I'm doing this by myself. We've all been warned about getting our papers in order by families, friends, that type of thing. And this should include our wishes for what happens to our property once we have died, but also in the process of getting there. It seems like we don't actually think about this much until much later in life. A couple of years ago, we had a few family members and friends pass on. We were involved with each of them up until their deaths, as well as handling some of their after-death wishes. And of course, there was some I don't know going on, but not too much. We did learn from those experiences. One of the things we experience is, where is the will? Is that really what she wants? That type of thing. Even those of us that had signed up to help didn't know all the answers. So Carol and I decided to put a couple things together. Number one, we would create all the legal paperwork that we're supposed to have. Now, you got to have all that stuff, I guess. Number two, we created a plain English version of what the paperwork really means so that someone could pick it up and read it and say, oh, this is what they really want. Actually, in some cases, we created the plain English version first and used that with the lawyer so they could create the legal version. In some cases, yeah, I went a little overboard adding definition of legal terms and such, but I find that very helpful. So today we have 2 binders. We have the treasure map, which is the plain English version, and we have all the legal documents, all the originals, copies of beneficiary forms from places like Schwab, anything that is a legal thing. Also, all of the documents that we have been digitized and they're on our phones. And we've also passed them to our children in digital form. And we also show the kids where the binders reside. And once the grandchildren get old enough, they get pointed in the right direction too. And I also like to go through them once a year to make sure nothing of substance has changed. And the only thing not included with the digital documents is account numbers and passwords for any financial account. These are stored in a sealed binder and in one sealed envelope in our binder. And when they need it, they can get it.
So to end today's presentation, I want to reiterate some key takeaways and reminders as you embark or continue on with the advanced care planning process. The underlying goals of advanced care planning are to respect an individual's goals, wishes, and values, improve quality of care, strengthen relationships, and prepare for the future. It is important to start these conversations early and have them often. It's important to remember that these conversations are unique and individual to each person and situation. When researching and planning for certain types of care, know that the cost and availability of services are likely to vary from one state to another. And when planning for care, it's good to remind ourselves to expect the unexpected and, of course, ask for help when needed. And with that, we will now transition to our Q&A panel and take some questions from our audience.
Wonderful. Thank you. Thank you. Thank you for such a great presentation. We have with us Debi, Linda, and Erin. I want to take just one moment to make sure everybody's here. I think we're missing Erin for a second. And Debi, are you here? Can we hear you? Okay, perfect. We'll continue to work on that to get Debi in here and we can hear her. And Linda and Erin, are you here as well?
Yep.
I'm here, Laura.
Okay, perfect. All right, there you are, Erin. You just didn't pop up on my screen. Awesome. And folks, you can continue to put your questions into the Q&A box at the bottom of your screen. And our folks behind the scenes, they will compile them and we'll continue to ask them. So we got a number of questions during the registration process, and I'll start off with those. So could we maybe start with something? The presentation did a great job of sort of providing an overview of what advanced care planning looks like and what this might be. Is there anything in particular that that maybe you all want to pull out that is of importance for folks who are living with Parkinson's in particular? You know, something that is maybe specific to PD or unique to having PD as the disease progresses.
Yeah, so I can tackle this one. So, I mean, as the presentation said, you know, a lot of the language we used was neurological condition and certainly did reference Parkinson's. So I think while there are some nuances and specificity that comes with Parkinson's compared to other neurological conditions, I think the advice holds true for everyone, regardless of chronic conditions. But yes, there are nuances. So, you know, Linda specifically mentioned, you know, in hospitalizations and the importance of maybe bringing an extra supply of meds. Well, for individuals with Parkinson's, we know that's especially important, right? Because the timing of medications and that with meals, you know, is really important. So certainly there are some things to kind of cue in on when it comes to Parkinson's. But really, again, I think this is something that with a Parkinson's diagnosis, you know, the old phrase adage goes, you know, if you see one person with Parkinson's, you see one person with Parkinson's. So while oftentimes this is a diagnosis that you can live well with for many years, you know, upon diagnosis, by no means am I encouraging you to kind of dive into this, as again, it can be emotionally heavy and a lot, but I would say, you know, this is something not to ignore. So, you know, upon getting a diagnosis, you know, again, to break it up in chunks and it can be helpful to look for what are the next 3 to 6 months have in store and kind of plan as you go. But yeah, so I think that's, you know, again, some general advice. And again, when having these specific conversations, it can be really central to include your care team. You know, how is your Parkinson's showing up? How is it affecting your daily life? And so how can we really cue in on how to address what challenges are at hand?
Awesome, thank you. That's very helpful to think about maybe the short term as well, to address in stages as opposed to maybe the whole, right? The whole pie sometimes looks a little bit too big. There were a couple of examples in the presentation about red flags that we might consider to increase care or to implement a plan. And I think the examples about, you know, car accidents or, you know, a couple of dings, or are there other red flags that you might suggest to folks to consider, or that you know that folks that you've worked with in the past have sort of used that as their guidance?
Yeah, I think during the presentation, Debi spoke about this, but I'm not sure if she's cued into the audio yet.
No, I can't.
So it looks like Debbie's audio is still not working. So, while we're working on that, I'll kind of tackle this. So yeah, so right, Debbie mentioned some specific red flags, but I kind of like to use kind of the frame in terms of kind of when do we need additional care, or when is, what's a red flag? And I think I use kind of that delineating line as, is this getting too much for me? Am I able to manage this, and at what cost? So I think this is all like with many things, right? Like people could be experiencing symptoms, but if it's not burdensome or challenging to them, then maybe nothing needs to be done. So kind of using that comparison of, okay, when is this kind of tipping the scales, or when is this becoming are falls becoming too frequent where, right, safety is a concern, even if you're not, people might say, well, I don't need a life alert, like I haven't fallen yet. Well, it's a preventative measure. Are you nearly falling? Are you experiencing almost falls? So a lot of it is, again, that constant assessment of how am I managing? How might I be managed? Again, kind of looking to the future a little bit. Is it getting too much? Are the challenges too much for me to address on my own? And again, this is all indications for yourself and those, kind of in your life observing you to say, okay, we need to address this, right? Like maybe one accident isn't enough, but maybe, oh, I almost hit a deer on my way home, or, oh, I kind of had to, swerve off the road. So I think it's also important that not only to, kind of account for when events really happen, but what are those like almost events as well?
Yeah, and I think that we've got Debbie now. Do you want to chime in at all?
Oh no, we don't have you, Debbie.
We'll get there, Debbie. We'll get there. Okay, so the follow-up to that is, I think that what are some advice that you might have for folks to handle some of these changes? I think that, making the decision to move forward with the plan and to implement the plan can be really sort of emotionally taxing and emotionally difficult. What advice do you have for folks to navigate those?
Yeah. Well, I think like some of our slides, in presentation spoke to, for me, it's really important to start where everyone's at, especially with different people being involved. They might be at a different place in terms of their knowledge and emotions. And I think first and foremost, to acknowledge where each individual person involved is at. And you might say, well, how is acknowledging going to solve it? Well, no, it won't necessarily solve the problem at hand, but it can help kind of, again, be grounding in knowing, okay, here's where I am, here's where you are, and being able to move forward in that conversation. Because often these conversations are going to involve an element of problem solving in terms of, okay, right, what resources, what's the next step, who do we have to get involved? But again, I think it's really important to acknowledge that emotional impact, because often we can get really bogged down with, okay, I have to do this, and very task oriented, which again is inherent in planning for care. But I think it's important to kind of slow yourself down to be able to process and acknowledge that these changes, the care required, is again, emotionally, financially, can be challenging. And to be able to say, okay, how am I going to attend to my own emotional needs? While kind of this planning process. And again, there's a variety of ways that you can kind of attend to that, right through individual counseling. Again, just even consultation with your physician and your care team can be instrumental, because again, hey, snapshot, this is where I am. This is what my concern is. This is, here are my challenges, kind of where to go from here. And then again, being able to, again, process within individual therapy, group therapy, support groups, your family, your friends, finding that outlet to be able to, have someone say, I see you, I hear you, this is heavy. Like, again, not going to solve the fact that you're going to have to do that kind of practical, like logical problem solving planning, but can be really palliative just in terms of, and kind of ease the psychological burden of like, I'm not alone. And wow, someone's honoring that this is hugely impacting my life and well-being.
Thank you, Erin. This next question is for Linda. and we always get a bunch of questions about sort of like tactical things that might be able to help us. But Linda, can you tell us about resources that might help folks to organize and prepare in advance of a hospital visit, whether that's planned or unplanned, sort of what's out there?
All right, so I can't stress enough the importance of being prepared for planned or unplanned hospital stay. And as Erin mentioned, we all know it is vital for people with Parkinson's to get their medication on time, every time. And so to help prepare for hospital stays, we really encourage all of our PD group members to get a hold of an Aware Care Kit from Parkinson's Foundation. We have found that it's a great toolkit and it's filled with the necessary resources to share with the hospital staff, your physicians, everybody on the medical team, to explain what's going on with Parkinson's, to explain symptoms, to explain what happens when you don't get your meds on time. And hopefully with educating everybody involved in your care, it's going to ensure a safe and hopefully brief hospital stay.
Yeah, thank you. Those Aware and Care Kits, I cannot say enough about them. You know, when we're out in the community, I hear so often how very, very helpful folks have found them for their hospital visits, and just having all of those resources in one location and able to sort of grab it and go. I talked to one gentleman not long ago who said that he actually keeps one in his car, and then there's also one next to the, you know, the door out to the car, you know, so there's two, right? They got a backup even, which I think is pretty smart.
Hi, Laura, can I interrupt you for a second?
Oh, absolutely, yeah.
So sorry. So I'm going to give Debbie a quick instructions to get her connected. So Debbie, will you look on your Zoom screen, and where you see the mute button, will you please select the arrow up? And then you're going to go to the call me, and it should say call me -connected, and you will hang up on this option. All right. Were you able to do that? And then can you unmute? Okay, Laura, I'm going to give it back to you, and I'm going to call Deborah.
Okay, no worries. Thank you. Thanks, Kayla, for popping in here and make sure we get everybody. Okay, one of our next questions is about taking care of the caretaker, the care partner as well. So we've talked a lot about care for our loved ones with Parkinson's. What are some resources or advice that you have for taking care of the care partner?
Yeah, absolutely. Such a good question. I think that often individuals who identify, right, as a care partner, a caregiver, or, you know, simply just, I'm an adult child, I'm a wife, you know, whatever kind of identity you kind of prescribe to, it's really important, right? You often will hear like, you have to take care of yourself in order to take care of others, but it's like, okay, but how do I do that, right? So it's like, I know I need to, but this is why I'm asking. So again, unfortunately, it's not a simple answer, right? Because it's going to be nuanced to your situation. What does taking care of yourself mean? And that's kind of why, you know, I talked a lot about in another step, like that introspection and assessment. And sometimes, right, it's we don't know what we need. So there's that challenge. But I think as a starting place, to try to do that internal kind of assessment, to say, like, to try to identify, well, where am I getting most overwhelmed? What do I need? Not only in order to take care of someone, but what do you need to take care of yourself? And that could mean practical support, or that could mean coping mechanisms. Do I need to learn more like internal strategies and coping mechanisms to be able to allow me to cope with the uncertainty that comes with caring for someone with Parkinson's disease? Because I think it's really, you know, important to highlight that, you know, often when we ask for help, practical strategies are often given, you know, as kind of a first line of defense. But oftentimes there's situations where we've accessed all the resources and referrals we can, and it may not still be filling that need. So then it requires us to really, kind of look internally to say, how can I take care of myself when my environment feels out of control? And again, nothing's going to be a panacea, nothing's going to solve all the problems, but there definitely are steps and strategies. Right. There's a lot of resources, support groups. I facilitate some, and there's support groups that are hosted around the country, both in person and virtual. All support groups are different. Some are more like, conversation-based, resource-based. Some have speakers. I kind of try to incorporate both those elements into mine, but that can just be a place to, again, feel like I'm not alone. To be able to give and receive feedback. Also, right, individual therapy, couples counseling, depending on your relationship with a person that you're caring for. So again, there's, no one approach, but I think it can start with a self-assessment. And again, if you don't know where to start, getting someone else involved, talking to your care team, talking to your doctor. Are they connected with a social worker? I realize that not every doctor may have a social worker present. Is there, an area agency on aging, someone who could be kind of a consult, or, again, so I think that self-assessment piece is a good place to start. And again, I'm a big proponent of individual therapy, right? You think you don't have to be really bad off to seek therapy. It actually can be good to kind of do it as a preventative measure to identify what are your needs, what are your goals, how can I develop those coping mechanisms to be able to get me through the next 3, 6, months, years, whatever comes.
Yeah, thank you, Erin.
Laura, can I add just real quick to Erin's? I just think it's so important, and so many of us don't want to ask for help. But if we don't take care of ourselves, there's no way we can take care of our loved ones. So don't ever hesitate to ask a friend, part of your medical team, anyone, to say, you know what, I need some help, I need some direction. You're not meant to do it alone.
Thank you. Thank you. I will just plug really quickly some of the work that the Parkinson's Foundation is doing. There are some pretty incredible resources around our Care Partner program. There's some educational courses online. Earlier this year, even, we hosted a Care Partner webinar, very similar to this, that was probably one of my favorite moments at the foundation thus far, where just all sorts of care partners getting together and talking about their experience. There's another one coming up here soon. I'm not going to tell you when it is right off the top of my head, but it's coming up, and take a look, because it was it was a really powerful experience to watch and to have everyone together like that. So of course, those support groups, even if they're virtual, they're helpful. All right. What about any advice on starting to find care agencies? Where should someone look for that? Start with their family doctor, or an agency on aging, or what advice do you have for starting that process?
Yeah, great question. Because that can be one of the most overwhelming, okay, I know I need the care, but where to start? So certainly if you are connected to a physician, especially like a larger medical center who has that multidisciplinary care, definitely starting there is a good idea. But again, appreciating that these rural areas in the country, you may not even have a movement disorder specialist. You may be seeking your Parkinson's care from a neurologist who may not be connected to like a wider team. So there should be, again, I think Debi mentioned the area agency on aging. So this is something that every state should have. And again, there's multiple area agencies on aging in each state that cover geographic areas. So honestly, if you can, go to your internet search bar and Google, or in search rather, the area agency on aging, there should be a website or a phone number, and that can be great. So again, as the name suggests, they are focused on older adults, but absolutely can cater to individuals, who are younger with disabilities as well. Often the local Department of Human Services, this might be the state program that administers Medicaid. They might have a division of rehab services as well. Again, this is where it gets tricky because each state's resources vary dramatically. But I would say like Department of Human Services, or if you can search like Department of Rehab Services, like those can be great places for referrals. I mean, also, again, if you feel so inclined and kind of, if internet comes naturally to you, I think just, typing in your search bar, like home care agencies, InHome Assistance, and, type in your city, you'll get a list. And then it really just involves kind of picking up the phone and kind of doing informal interviews, like what type of care do you provide? And then, asking them, do you help with this task? What is your hourly rate? Do you provide 24/7 care? How would the 24/7 cost compare to an hourly rate? So, and there are, again, interview guides on the internet that can be, to kind of get those list of questions. So it can be a good place to start, again, kind of accessing your network online, and then being able to just pick up the phone and start calling these places.
Awesome. Thank you. I'll say too, I know that the foundation, and we'll pull this out so that it comes in the email that everybody gets, but the foundation has a bunch of resources too on how to conduct some of those interviews and how to choose some of those care agencies that can be really, really helpful, because it is, we didn't learn that in school. All right. A couple more questions here. Next one is about planning for retirement. So person with Parkinson's, living their life, working still, what are some red flags that they might consider on when to retire, and sort of how to, there's probably not a great answer to this, but how do we maximize, working age and saving for retirement and care and progression? And also in that question is workplace accommodations to ask for, to look for as well.
Yeah, so great question. And I think that this is one that many people with Parkinson's who are still working are faced with, right? Kind of balancing the need to work. Again, kind of appreciating a lot what we highlighted, that care is important, but kind of balancing that with, am I able to do the job that I was set out to do? So again, this is where, unfortunately, like many of the answers here, is nuanced and is going to be, again, very based on your situation, which is where kind of, catered conversations with your care team can be really instrumental in kind of unpacking and digging deep into your situation. But certainly I would say, yeah, so this is where that kind of constant assessment is going to come in terms of, okay, we have this financial piece, but am I able to kind of fulfill my work duties? And again, that's going to be constant assessment, internally. But this is where I will say there are some specific resources. So definitely, getting a financial planner or an elder law attorney involved to be able to say, here's my financial situation. Here's what I have saved in my, retirement package. Here's the type of care. Again, we don't know like how long you're going to need that care. So a lot of it, is uncertainty, but we can guesstimate. So here's the type of care. And, I want to plan for 10 years. And this is the type of care I might need. So to be able to talk to a financial planner, the sooner, the better. And then certainly, right, every workplace is different in terms of, right, like disclosing and accommodations and, who you disclose to, again, is very personal choice. And then accommodations, like there are some protections afforded to you by the Americans with Disabilities Act and other certain protections, usually it is, again, for employees with employers who have like 50 or more individuals. But there are certain protections. I would definitely plug the Job Accommodation Network. If you go to askjan.org, there's a number where they kind of work as like a consult service to be able to say, hey, here's my situations. If you're actually needing those workplace accommodations, again, very much something that your physician and care team, I would defer to them, as they will be able to fill out like Family Medical Leave Act, FMLA documentation, or again, your benefits HR department might require certain documentation if you need workplace accommodations. But I would say the Job Accommodation Network, JAN for short, again, askjan.org. If you go online, they actually have a page dedicated for folks with Parkinson's, and it lists a whole bunch of accommodations. So again, I wouldn't say to ask for all accommodations at once, but you can kind of go through the list and say, oh, this would be key for me, and to be able to get ideas of what might be able to kind of allow you to kind of keep your current position. And again, every employer is different. So your comfort level, your protection. So this is where that delicate balance will be about, having those unique conversations with your employer. Because, is there a different type of job you can do? Not all employers are going to be amenable to kind of changing your job duties. But, so again, this is where kind of the nuance comes. But I would say financial planner and job accommodation network as two like practical resources to access in this specific situation for individuals who are still working, wanting to still work, are able to still work, potentially need accommodations, and want to plan for the future.
Awesome. Thank you, Erin. All right. I'm going to take one last question. And this, I'll say, folks, is wrapped up into, I think there were a bunch of questions around, more specifically around finances and legal questions. And so I wanted to pose that question to plug also the next two sessions in this series. So what can we expect and what will we learn, if we plug back in next month, and in July will be the third one.
Yeah, great question. So our, as we mentioned, kind of the second and third iteration of this kind of overall advanced care planning series, session 2, which will be June 1st, the first Wednesday of June, will really dive deep into kind of the legal aspects, right? So we talked about all this care, and we even mentioned elder law attorneys. Well, we're actually going to hear from an elder law attorney who's based out of Chicagoland in Illinois. So again, resources and situations may vary state to state, but that's really going to dive deep on, like these legal aspects, what documents, how to fill out the documents, kind of those nuances to be able to make our wishes known. So definitely the legal planning, and they kind of get into trusts and some nuances in Medicaid and planning for that. So definitely, I think that's going to be central. Again, there's still so much that we weren't even able to address in that, presentation, but can be really helpful. And again, starting to think about some of those document piece. And then the first Wednesday of July, we'll come back. I think Debi highlighted the importance of palliative care. And so we're going to have the July session, we'll dig a little deeper into palliative hospice and end of life discussions. Again, emotionally heavy topics, but something that's really important, as we have these advanced care planning conversations to plan for, okay, what does that supportive care look like? There's so many myths, and misinformation about what these services are and what it means and what it doesn't mean. So we're really hoping to be able to address that. And again, really honor, again, that emotional impact in having these difficult discussions.
Wonderful. Thank you, Erin. Yeah, certainly difficult topics, but necessary. And, we really appreciate your expertise, and Linda and Debi as well. So with that, we're going to conclude our program for today, and want to say thank you again to our speakers, to Erin and Linda and Debi, for providing your expertise and your time with us today. And thank you to you all for joining us. You'll receive a follow-up email with a survey and all sorts of other information and resources from today's program. You'll also receive a link to today's presentation and additional resources. You can look for that within about a week of today. And we'll try to include all sorts of the extra stuff that was mentioned so that you can find it easily and find your internet search bar stuff quickly. I want to say too, please continue to join us throughout 2022 for our PD Health at Home programs. You can learn more and go to parkinson.org/pdhealth to see upcoming and archive webinars. So if you want to go back to that Care Partner one that I mentioned, you can watch that as well. If you had a question today that was not answered, or if you think of one after today's presentation, please reach out to our helpline by calling 1-800-4PD-INFO or emailing helpline@parkinson.org. The folks on the other end of the phone or on the other end of the email will help to guide you to some answers as well. Thank you again for joining us, and stay well. And we hope to see you again for another PD Health at Home program soon, and definitely here in June for the next one of our series. Thanks so much.